Well, good morning, Joginder Rana here. So, we'll discuss today government health insurance schemes in India. Government health insurance schemes in India. A government health insurance scheme is simply a medical policy created by the Government of India that ensures you and your family from bearing the heavy cost of health care. However, many people in India are not even aware that there are multiple options provided by the government when it comes to medical care. So, a medical emergency can happen anytime, anywhere, and to anyone. This makes it extremely important for everyone to keep an active health insurance policy. Government health insurance schemes are more suited for people belonging to lower and middle income strata. This is done to ensure that people from all walks of life have access to healthcare and medical facilities at affordable rates. So basically, there is a difference between regular health plans and government health insurance schemes. Regular health insurance schemes and government health insurance schemes strive to achieve the same goal: providing accessible health care and keeping you insured if you have a medical emergency. However, there are many differences in the offering of both the type of policies. So let us compare a regular health insurance scheme with a government health insurance scheme. Arguably, the deciding factor of insurance schemes is the premium. So one must pay to stay insured. Now, government health insurance schemes usually have lower premium as compared to private health insurance schemes. Then many government plans provide a range of medical coverage facilities such as pre and post hospitalization charges, examinations and lab test coverage, as well as accidental damage or death cover, and that too at a very low budget or friendly premiums. So in this case, if you are eligible for a government health policy, there is no harm in purchasing it for safekeeping during emergencies. Then the sum insured amount. The government health policies are often targeted to middle and lower income groups, thereby the policies are super affordable, but the sum insured is comparatively lower than what private insurance firms offer. It is worth noting that government health insurance mostly provide medical care in government hospitals, while regular health insurance schemes offered by private insurance firms have tie-up with private hospitals. So in many states, the experience of getting treatment at government hospitals could disappoint you. It's often better to opt for regular health insurance schemes to ensure comfortable medical expenses. There's a long list of government health insurance schemes in India. For example, Ayushman Bharat Yojana, launched by Ministry of Health and family welfare, the Ayushman Bharat Yojana aims at providing universal and free health insurance facilities. So this is aimed at providing universal and free health insurance facilities. The scheme offers a coverage of INR 5 lakh and also provide medicines, diagnostic expenses, medical treatment, cost as well as pre-hospitalization expenses. So this is aimed to benefit people who are at the lowest rung of the socio-economic strata. And then comes Pradhan Mantri Suraksha Bima Yojana. So the Pradhan Mantri Suraksha Bima Yojana is specifically crafted to protect Indian citizens between the age of 18 to 70 who have an active bank account from medical charges related to disability or death arising from accidents. So the policy ensures an annual coverage of INR 2 lakh in case of disability or death due to accident and INR 1 lakh in cash in cases of partial disability. So the premium get automatically debited from the policyholder's bank account. The next one is Aam Aadmi Bima Yojana. Formulated in 2007, the Aam Aadmi Bima Yojana was created to solve the problems of people living in the Indian countryside or developing towns. So the policy also includes provisions of providing scholarships to underprivileged children in India as a means to promote education. Anyone between the age of 18 to 59 can avail this policy, and it specifically extends to people who do not own lands and are living as tenants in urban and rural areas. But the policyholder is usually the head of the family who pays a premium of INR 200 annually. Upon natural death, the family is compensated with INR 30,000, while in cases of death due to permanent disability, the family is compensated with 75,000 rupees. Then there is Jansari Bima Yojana. So launched together under the aegis of the Government of India and the Life Insurance Corporation, the Jansari Bima Yojana insurance provides to people living below the poverty line in urban rural areas. The policy is aimed at the working class of India who are categorized in different occupations. The policy is currently offered to 45 varied occupational groups. General benefits of the policy include financial compensation to the legal heir on death due to natural or accident of the policyholder. It also includes financial compensation in cases of total or partial disabilities. The most notably, the policy includes benefits made especially for women. This spans maternity benefits to treatment fees for female critical illnesses. Then Mukhyamantri Amritam Yojana. So launched by the government of Gujarat in 2012, the Mukhyamantri Amritam Yojana initially created to families and individuals living under the poverty line. However, after many considerations and amendments, the benefit of the policy were also extended to people belonging to the lower income group. The major benefit of this scheme is that it covers the complete medical expenditure from diagnostic examinations to post-hospitalization care. The best part is that the scheme does not require any endowment amount or insurance premium to be paid. It also covers a wide range of medical ailments whose treatment will be fully funded by the government. So a sum insured of INR 3 lakh is provided to all policyholders. However, in cases of special treatment such as kidney, liver or pancreas transplant, the sum insured increases to rupees 5 lakhs. So an important thing to note is that a maximum of 5 people in every family can enroll for this scheme. And Mahatma Jyotiba Phule Jan Arogya Yojana. So the Mahatma Jyotiba Phule Jan Arogya Yojana was curated by the Government of Maharashtra for the domiciles of the state. The primary goal is to provide cashless medical facilities and quality health care to people of lower income groups. So the policy covers an extensive visit of 971 medical procedures with additional 120 post-therapy packages. These also include orthopedic surgeries, gynecologic and obstetric treatments, cardiac surgeries, radiation surgeries, as well as plastic surgeries, among many others. So while the sum insured amount per family is just rupees 1.50 lakh for every year, which is low, the benefit of the scheme are diverse. Now, the insurance premium is borne by the state. Medical benefits also cover consultation charges along with diagnostic care expenses. Apart from government hospitals, there are several private hospitals that consider the policy and offer treatments to the beneficiaries. Next one is Bhamasa Swasthya Bima Yojana. So catering to the people of Rajasthan, the government of Rajasthan formulated the Bhamasa Swasthya Bima Yojana. The primary beneficiaries for this policy are those belonging to low-income families who are permanent residents of Rajasthan. Benefits of the policy includes a sum insured of INR 5 lakh for treatment and emergencies. It also has a special advantage for women policyholders as they can use their Bhamasa Swasthya Bima Yojana policy cards to purchase rations from authorized PDS outlets. This is a unique feature added by the government of Rajasthan to promote healthcare awareness in women. Next one is Rashtriya Swasthya Bima Yojana. So categorized as a family floater health insurance policy, this is a government-sponsored health insurance policy for people living under the poverty line. The policy has a very low premium and no age limit to enroll. The sum insured is up to rupees 3 lakh. So apart from the regular benefits offered by the government in their health insurance policies, the Rashtriya Swasthya Bima Yojana takes a few steps ahead of incorporating dental care, daycare treatment, transportation expenses, maternity benefits and newborn coverage alongside pre and post hospitalization cover. Then Central Government Health Schemes, CGHS. The Central Government Health Scheme was launched in 1954 and primarily caters to officials working with the central government such as Supreme Court judges and central railway officials. The policy also includes pensioners. The policy aims to provide hospitalization and domiciliary care, including medication from allopathy as well as homeopathy. So this scheme also provides free X-rays and laboratory examinations facilities to central government officials. This central government health scheme has 35 lakh beneficiaries and is active in 71 cities presently. Then there is Universal Health Insurance Scheme. Another one of the central government's flagship health insurance scheme. The Universal Health Insurance Scheme is curated to cater a wide range of people living below the poverty line and just above the poverty line. So the policy includes hospitalization coverage and also maternity coverage. The policy largely covers the medical treatment cost as well as accident coverage to the primary income earner of the family. In case of death due to an accident, the family will receive an insurance amount. Next one is West Bengal Health Scheme. So the West Bengal has been commended many times for its prioritization of bettering public health infrastructure. In this regard, taking the West Bengal health scheme could be a lifesaver. However, this can only be availed by people in All India services or pensioners. So this scheme provides treatment cost for at least 1014 medical ailments, including OPD treatments. The key features of the policy include cashless claims, reimbursement for treatment in non-empaneled hospitals, OPD treatment coverage, and out of hospitalization charges coverage. So registration and enrollment for policy can also be done online on the official portal of West Bengal Health Scheme. The next one is Yashasvi Health Insurance Scheme. Considering the plight of farmers, lowering income and middle income groups in the state of Karnataka, the state government along with the development cooperative sponsors the Yashasvi Health Insurance Scheme. This policy is meant to provide high quality yet affordable care in Karnataka. The sum insured for policyholders is INR 5 lakh along with an added advantage of cashless claims at network hospitals. The scheme also includes claim benefit for 1,650 diseases, and one can also get discounts on certain diagnostic or treatment costs. Karuna Health Scheme focuses on providing healthcare access for people of Kerala facing critical illness. People of the lower income groups can avail this policy to get medical facilities for chronic ailments, including cancer, cardiovascular issues, and palliative care, amongst many. So the sum insured for the Karunya Health Scheme is INR 5 lakh rupees per family. The coverage includes expenditure for diagnostic care, consultation, pre and post hospitalization charges, and intensive care treatments. Awaaz Health Insurance Scheme, another one of the government of Kerala's brainchild. The Awaaz Health Insurance Scheme focuses on providing insurance for migrant workers. So migrant workers living in the state of Kerala and between the age of 18 to 16 can avail this policy. Each policyholder can avail free medical care of up to Rs 15,000 in government hospitals across the state, and the scheme also includes health impact due to accidents for the migrant workers. Then Telangana State Government Employees and Journalist Health Scheme. A unique insurance policy curated by the Telangana State Government is the EJHS, Employees and Journalist Health Scheme, or Employees and Journalist Health Scheme. So the policy, as the name suggests, promotes health care and welfare for its professionals, including journalists and their families. The policy entitles them to avail cashless hospitalization coverage across network hospitals in the state. The benefits include inpatient and outpatient treatment, hospital stay, as well as follow-up services. The coverage in the policy does not have any upper limit. Employment State Insurance Scheme, one of the oldest health insurance policies formulated by the Government of India. The Employment State Insurance Scheme provides coverage for working professionals. Usually a company with more than 10 employees should register itself for the ESI scheme. This scheme includes a wide range of health-related contingencies and also offers pension options to the families in cases of death or disablement due to occupational hazards. So the policy includes coverage for sickness, maternity, disability, and employment, funeral cost, and old age medical care, amongst others. Then Dr. YSR Arogya Healthcare Trust, an initiative by the government of Andhra Pradesh. The Dr. YSR Arogya Shri Healthcare Trust ensures the people of the state who will fall in lower income strata. This healthcare insurance includes a variety of benefits, including maternity coverage, rehabilitation services, cashless claims, as well as continuity of care from diagnosis to post-treatment care. So the policy has a strong focus on preventive measures of healthcare, which includes free health checkups and screening for certain ailments. The policy also covers treatment for numerous chronic diseases, including chemotherapy, radiation therapy, and dialysis. The Chief Minister's Comprehensive Insurance Scheme is doing wonders in its home state of Tamil Nadu, with almost 65% of the population of the state enrolled under this scheme. Low-income families can now opt for this scheme and avail the full range of medical facilities with benefits. So the sum insured to the family is rupees 5 lakh per year. The policy opens doors to a huge number of network hospitals. Empaneled hospitals also conduct free health checkup and camps of fun, and policyholders have a dedicated 24/7 helpline to get support if needed. And the last one is one of the most popular government health insurance scheme, the Rajiv Arogya Shri Community Health Insurance Scheme was launched by the government of Andhra Pradesh using a unique and innovative social approach. So the policy work on a private-public partnership to ensure economically backward people also receive quality healthcare services without any hassles. The people living below poverty line and possessing a ration card are automatically enrolled in this scheme. So the list of network hospitals also include private hospitals along with the government hospitals. The premium price is moderately low. There are more than 900 medical procedures that are covered under this policy. So one of the major priorities of government is to ensure its citizens can avail high quality and accessible health care. In a developing country like India with a huge population unable to afford costly medical treatment, the government of India is curating healthcare policies on the basis of local and national requirements. So it is important to know about these policies to access affordable healthcare as well as educate other people for whom this could be a life-saving wonder that also saves them from financial burdens. Thank you very much.